This is basically going to apply to outpatient and inpatient, anything, dual mobility. It works, but not for everybody. No noticeable disclosures. I don't work on any dual mobility implants. It sounds like we should be putting dual mobility in everyone because it's God's savior to dislocation rates, right? Everybody doesn't want dislocation rates. They're a big push from the companies when they release new dual mobilities. We should do this for everybody. We heard the same story 2006 with large head metal on metal, and we see where that ended up. So we have to be careful when we're introducing these new technologies, and this is technically a new technology for the operating room. It is an important step forward, but we still, I think, need to be cautious. Concerns, cobalt chromium levels. Now, not all of them are made with cobalt chromium. There's some that are ceramicized metal, so maybe that mitigates it. Polywear, cost, dislocation, intraprosthetic dislocation. These are my concerns, and I'm going to start with those and then tell you when do we use it now and what I think we should do going forward. American Joint Replacement Registry, dual mobility use, slight uptick. Still, 36 millimeter heads are the number one most common bearing, and that's probably correct. For what we should do. 40 millimeter heads, 44 is going up slightly, but dual mobility is hanging out around 10% of what we do. When you break this down by age, it's a little bit higher in the 90-year-olds. You don't want to come back to the OR in an 80 or 90-year-olds. That might make sense, and maybe they won't be around long enough to have any of these other risks. Maybe not. It's still costly. If you're thinking about this, again, dual mobility rate revisions, if you use it in a primary, is actually higher than a primary. And you may say it's probably a little bit biased just because you're using dual mobility in more complicated cases, but just something to be concerned about, right? You're coming back, the revision rate is higher. Not all dual mobilities are created equally. There's monoblock dual mobilities. This is all the French data that you read, they're all monoblock dual mobilities. One single piece has a tabular component, so there's no corrosion there because there's nothing that's moving, right? One piece. And then some of them are made with liners that seat flush.